So we're going to cover what are the symptoms of a low thyroid. We're also going to cover what are the labs that really should be performed versus what's routinely performed, and kind of how to analyze it. And then lastly, we're going to go into, well, what if your labs are normal? You've had a very thorough workup that we're going to talk about, but yet despite that, you're still not feeling good, right? You still have the symptoms. So very first, let's get going on what are symptoms of a low thyroid, because even though the thyroid can go high, it's much more common to have a low thyroid. So let's discuss what a low thyroid actually looks like, okay? Now, when we look at thyroid controls the rate and function at which cells in the body function. So if it does that, well, if the rate goes down, it's common to have symptoms of fatigue. What if it goes down in your gut? Well, you could have constipation. Maybe you have bloating, maybe you have heartburn. What if it goes down in your skin? Well, you have dry skin. You can also end up with hair loss. What if it goes down in your brain? Maybe now you end up with depression, brain fog. Now, depending on how you describe brain fog, this could be problems of finding words, focus, concentration, not feeling as sharp, along with depression, motivation. Okay. What else could you have? Well, you could have headaches and even dizziness. So these are all the symptoms that when you've got a low thyroid, that can be caused from it. Now, a lot of people are going to Dr. Google, they're going to their primary care, natural health care providers and saying, hey, my thyroid is low. I swear it is. Why do I swear it is? Well, it's because I've got fatigue. I've got hair loss. I've got brain fog. Oh, should we also put what drives everyone nuts? Weight, right? It's hard losing weight. So you've got weight gain. The weight is stubborn. So that is another symptom, right? So just quick review, symptoms of a low thyroid that leads to people getting labs done. Once we've covered this, we're then going to go into what are the labs that are routinely done, but what are the ones that should be considered and performed? So fatigue, constipation, dry skin, hair loss, weight gain, dizziness, headaches, brain fog, and depression. All right, so now we've covered what's actually the symptoms that are causing people to go to a healthcare provider. Let's actually look at what happens within the body. So you've got your thyroid, which is right here in your neck, okay? So you've got your thyroid gland. Thyroid is going to release something called TSH. Sorry, let's go back. When we look at this, you've got something called the pituitary. This is in your brain. It's going to release something called TSH. TSH is going to go to your thyroid and say, hey, let's produce thyroid hormones. Most of the initial thyroid hormones are produced are T4, and then you've got T3. T3 is the body's active usable form of thyroid. So let's say you're on thyroid medications. Most people are put on a T4 replacement, levothyroxine, with the brand name being Synthroid. Whereas on T3, you could get put on liothyronine, okay? But when we look at when most people get labs performed by a regular provider, they're only getting TSH and they're often getting T4. they usually do not get anything beyond that. And as we're going to discuss, there's a lot of issues when that's the only thing performed and you're not going beyond that. Now, if you do have questions, please let me know. I want to make sure I'm addressing these as we're working through this to better understand thyroid and helping you get the answers and solutions you need, because most people are not getting a comprehensive thyroid evaluation. So TSH, what is TSH? This is thyroid stimulating hormone. Think about it. It's your manager. It wants good output from your thyroid. So if you have good production, TSH is going to go down because it's like, cool, we're happy with what's going on. But if your thyroid production goes low, so your T4, your T3 goes down, your TSH starts going up because it is yelling. It's like, hey, we're not producing what we need. You've got to do a better job, leading to the symptoms we talked about: fatigue, brain fog, weight gain, constipation, hair loss, and other things like that. So what are most people generically getting ran if they go to a primary care provider? TSH and T4. But is this the whole story? Is this adequate? And the answer is no, it's not. So when we look at T4 and T3, T4 1 is converted into T3. T3 is the usable form. Now, with T4 and T3, there's what's called a total, and then there is a free. So think about it like you've got money locked away in the bank account. You can't access it. You can't spend it. That is your total. Your free is what your body actually uses. So the most useful measure of what your body actually has to use is your free T3. Okay. So free T3 is the most usable form of thyroid. So if your free T3 is not being checked, your TSH can look okay and your T4 can be okay, but you can definitely have issues that are absolutely related to your thyroid. And the only reason why you're not getting the answers is because the right labs haven't actually been checked yet. Once again, if you've got questions, let me know. I'll answer them as we go through this. So what should actually be ran out as we're looking at a thyroid panel? So I'm going to put that up here. Okay. So thyroid panel. We need TSH. TSH is what tells our thyroid, I need you to produce. Normally, they're looking for this to go up. When we look at lab range, it's really up to about a 3.5 or a 4, depending on the lab, is considered normal. But even when it's flirting with that or up more than that, hey, we're having issues with thyroid production. We also need to have a T4 because that's the most commonly produced thyroid hormone. We need T3. T3 is more usable within the body, but we also said there's a total and there's a free. So you should have a free T4, free T3. So this gets us through. Brain says, hey, we need to produce. So thyroid says, hey, let's produce. We make T4, and there's some T3 created. T3 is converted, or T4 is converted into T3 primarily within the liver, but also can occur within different organs throughout the body, including the kidneys, the brain, and the gut. You've got free is what your body actually uses. Free T3, you really need to know where you're at. Lab range typically is anywhere from a 2.3, 2.4 up to a 4.5. I've even seen a 5 now. And you don't want to be on the low end. And I'm going to get into that a little bit more from a nuanced perspective so you understand, are we getting appropriate output? So this is the beginning part. But is this enough? And the answer is no, it's actually not. Because if your thyroid's going low, we have to say, well, what is this? Well, when we look at low thyroid, the most common cause of a low thyroid is your body attacking your thyroid. So it's autoimmunity. Your own immune system is attacking your tissue. What is the most common form? thyroperoxidase antibodies, TPO antibodies, needs to be checked. And don't worry, I will go into silent versus active autoimmunity because a lot of people get stuck in this autoimmune phase where their thyroid looks okay, but yeah, they're still struggling. And it's because we're letting the destruction occur and we're not treating it yet because someone can't get medicated. So that's one. Next is thyroglobulin antibodies. Ultimately, TPO helps with the conversion of thyroid hormones. Thyroglobulin is more of a storage place, but also is used in building thyroid hormones as well. So this is really what should be done. Now, there are a few other markers that could be done, like reverse T3. But if you're wanting a comprehensive thyroid evaluation, you need to make sure TSH, T4, T3, free T4, free T3, TPO, and thyroglobulin antibodies are performed, right? Make sure that is done because if not, I routinely see people who are told their labs are normal when it's definitely not. All right. Once again, if you've got questions, let me know. We're going to move on to interpreting your lab values. So when we look at thyroid function, normal function is going to be TSH looks good, T4, T3, T4, and T3 free, but also all the autoimmune markers look normal. Well, what happens now when we have a TSH that is, let's say it's fine. Let's say a T4 is fine. And then a T3 is low. This is going to be a conversion issue. Now, let's say this was off, right? And TSH was actually elevated. In medicine, most people would just be prescribed a medication. But from a functional, natural approach to medicine, where you say, hey, you know what? It's actually doing okay, but we've got a conversion issue, right? If T4 is 50 percentile, T3 should be 50 percentile if conversion is okay. If not, what's going on? Well, we said most of the conversion for your thyroid, so your T4 to your T3, occurs in your liver. So what do those liver markers look like, right? Let's make sure the liver is healthy. If it's not, then that alone could be a reason for this. So it's not necessarily, you always have to do a medication, but you can support this. So that's something to know about. Now, something that I see commonly, especially in females who are on hormone replacement therapy, okay? Their TSH will be okay. Their T4, I would say, is on the high end. T3 is on the high end, but then free T4 is on the low end. Free T3 is also on the low end. Did you know that when you do hormone replacement therapy, specifically like estrogen, it causes the binding of your thyroid hormone to where it doesn't release it? So hormone replacement therapy can actually make you function like you're hypothyroid. So this is something I actually have to work through quite a bit with females, is getting their estrogen back to where it should be so it's not messing with their thyroid and getting everything back on track. All right, are you learning stuff? Is this new? Hopefully this is helping you approach this differently. Okay. All right, next. I want to go into, let's say you get your labs done, your TPO or your thyroglobulin antibodies are elevated. Thyroglobulin and TPO, that is autoimmunity to your thyroid. Now, autoimmunity can actually occur 6 months, 5, 10 years before your thyroid function gets impacted. And this is why it's so important that if you've got symptoms of a low thyroid, we're not just doing TSH, because your thyroid is going to keep producing hormones for so long until it's like, look, there's so much damage, we can't do it. We don't want the damage to occur. We want to have thyroid functioning. Unfortunately, when I was in school learning to be a prescriber, they're like, it doesn't matter. You'll just give them levothyroxine at the end of the day. But it does matter, Because did you know if you have one autoimmune disorder, your risk for others does go up? So it's not sufficient to just medicate someone's thyroid with levothyroxine. Maybe if you do natural and you do armor thyroid, we need to make sure we control the immune system and get it underneath control. So when we look at thyroid autoimmunity, there are 3 phases of thyroid autoimmunity that everyone should know. First phase, this is silent autoimmunity. Silent autoimmunity means your antibodies, so I'm just going to put AB, okay? Your antibodies are positive, your TPO or your thyroid globulin, these are elevated. That is silent autoimmunity because guess what? You don't have any symptoms yet. So silent autoimmunity. Next is going to be stage 2. And this is often or what they call like a euthyroid state, which means your thyroid function is normal. But the difference here is, right, your TSH is normal, T4, T3, all of those are normal. But you have the antibodies and you have symptoms. So a lot of those symptoms we talked about earlier with thyroid issues, fatigue, brain fog, weight gain, low libido, constipation, motivation, other things like that are being impacted. So that is stage 2. Now, once again, this can take weeks, this can take years to transition from one phase to the next. And then last one, we'll just call it active. Okay, this is full-blown autoimmunity. Full-blown autoimmunity, the way this looks on labs is your TSH is now elevated. Your T4 is now down. Your T3 is now down. Once again, your free are also low. The problem is when we look at healthcare, we wait for people to be in this stage where they've got, hey, remember, TSH is the manager. It is yelling. It's like, come on, thyroid, please produce more. And so when you look at your TSH, it may be an 8. It could be a 20. It could be a 30. Because it wants this to be in a better spot. And it can't do it because there's enough destruction. Because the autoimmune response went unchecked for too long. So when is the best time to catch this? The best time to catch it is here. And then the next best time is when you're in the euthyroid state. Now, who's at higher risk? Well, it's females. So if your mom has autoimmunity to her thyroid, the risk you're going to have autoimmunity if you're a female is going to be a lot higher. So get these labs done, know where you're at, because if you know where you're at, you can keep yourself in the silent phase much longer compared to letting it progress. All right. Now, the last thing I want to go into before we talk about other things that you should consider if your thyroid actually looks completely normal is when we look at thyroid hormone production, we also have to make sure your body has the vitamins and minerals that it needs. Because if it doesn't, that also can cause your body to not produce enough thyroid hormones. And unfortunately, we live in a time where people are not getting the vitamins and minerals they need. We're having a lot of ultra processed foods, right? Fast food restaurants. Hey, I got this, let's throw it in the microwave or, air fryer. But what are some of those things that your body actually needs to produce hormone? If you're iodine deficient, which pretty much no one is, but that can do it. Selenium is super important in not only thyroid production, but protecting the thyroid. Iron. So females specifically, if you have heavy menstrual cycles and your thyroid is off, make sure your iron's actually being checked because anemia can make your thyroid go off. And it's not enough just to a red blood cell. Okay. You need to look at a full iron panel. Zinc, vitamin A. Okay. B12. So we've got different vitamins and minerals that, when they're off, can actually impair your body's ability to produce thyroid hormones as well. So there's two approaches to this, right? There's the approach I was taught when I was in nurse practitioner school, which was, hey, TSH is elevated, T4, T3 is low. They're going to be on levothyroxine or Synthroid the rest of their life. But then there's the functional approach. Say, like, well, what does the body need to function appropriately? Well, if it doesn't have the building blocks, yeah, we can replace the thyroid hormone, but isn't it better to try to let the body do what it can do? Right? Let's give it what it needs. This is part of the reason why we have so many health issues today, is we're being told we need a magic bullet. We're being told we need a quick fix. But you've got so much power. I get people with diabetes, with gut issues, that we work on lifestyle factors, and they're doing so much better than they did even when they were on multiple medications, because they are now getting a holistic, well-rounded approach. It's not just one thing or the other. All right, once again, if you've got questions, make sure to ask them. And if you haven't, please subscribe to this channel. That's how we make sure more people get it and keep making stuff. Now, what if your labs really are normal, right? I get lots of people who come in, they've had their thyroid panel checked 3 or 4 times. They've had everything: TSH, T4, T3, free and total, thyroid autoimmune response. And they say, hey, Dr. Z, my thyroid labs are normal. Are you sure? Like, what's causing my fatigue? What's causing my brain fog, my lack of motivation? Well, here are the things that I find that really play a big role. And we're not going to go into these in detail, but things that I find that should always be considered. Anemia. I would like to think anemia is being routinely checked, but in my experience of checking this, so many people are dealing with anemia. So anemia is going to be decreased iron, usually. But then for some people, it's even B vitamins, specifically like B12. Okay, if this is off, guess what? It's going to give you all the same symptoms, and you're not going to feel any better. What else should be checked? Blood sugar. And I'm not talking about just a fasting glucose. Get an insulin, get a C-peptide, get an A1C. Know where things are at. What else? Medications. Yes, lots of medications people are on will give them fatigue as well. Now, foods. So the foods we're eating can drive inflammation and can give us symptoms of low thyroid as well. And then the last one is brain. Did you know that the brain, even though it only weighs a few pounds, it has the highest caloric need? So it uses more energy, it demands more energy than any other part of your body, even than your muscles. Yes, your brain demands it, right? So it uses 25% of the entire body's energy when it's healthy. I get lots of people who have brains that are not as healthy as they should be. Sometimes it's from old car accidents, concussions, whiplash, mold exposure, whatever it is. There's all sorts of things that impact brain health. And when we test their brain function through eye movements and balance testing, they have all sorts of issues that we find. And it's when we address what's actually causing it versus going after symptoms, do they fully get better? And this is why if someone comes in and they want to be a patient and they're like, hey, can I get my, I think I'm dealing with a thyroid issue. I'm always going while I'll check their thyroid labs, I'm always going to encourage, let's look at the full picture. Because for most of the people who come in, their thyroid labs actually are normal. Now, it doesn't mean it's not an issue for some people, because it really is. But let's look at you as a whole person and realize that you can, one, have more than one thing going on. Two, the fatigue's not always from the thyroid. And when we take a holistic approach, we put together the pieces of your puzzle. That's when you finally get the answers and solutions you're looking for. But you only do it when you do it as a unit. So it's like you got your favorite band, right? What if the drummer, the bass, the regular guitar, the singer are not on in sync, and are they all doing their what they should be, just not at the right time, and they're not working together? Then guess what? You don't get the music you love, right? So if someone has anemia and that's all you address, and then their blood sugar and you don't address it, then guess what? You're not going to get better. So taking a holistic, comprehensive approach to health can be game changing. We've got to leave our biases of separating the body into little pieces and realize that one part of the body impacts the other. Thyroid can impact your brain can impact your gut can impact your thyroid, right? It's all connected as a unit. So I trust that you found this information useful. If you've got any last questions, let me know. If you liked this format with having a whiteboard behind me, let me know, because I will for sure do more with a whiteboard in the back if people like it. Share this with others and make sure to subscribe. Until next time, this is Dr. Z.